Welcome back to my channel, and in this video I'm going to talk about the Ozempic and the real world scenario that is Ozempic really connected to suicide or not, because there's been a lot of debate on that. So I thought to bring a small discussion about that I found out on Medscape. It's a very authentic place to find out some good publications and good discussions and good latest technology as well, because latest research, latest technology and latest drugs and a lot of most recent things are there that you can literally find on Medscape. So I thought to bring it forward to the attention of the audience that it's important discussion anyways, because it's related to your health, it's related to your life, so you cannot take it too lightly. Okay, so the background is that in July 2023, the European Medicine Agency, they released a statement that there is a threat. There is a threat from Ozempic to the brain and basically to the psychiatry of the patients taking it, and that's why it can lead to the suicide, and that's why there were further consequential researches and studies on that whether it is a real legit thing that they should do or should they wait on that kind of thing, because they were saying that there is a risk for suicide and suicidal thoughts. And the reason for that review is the Icelandic Medicines Agency. They had reviewed reports of up to 150 people who took the drug and experienced some suicidal thoughts or self-injury related things. That's why this kind of thing came in the last year 2023, and then that's what was followed through by the JAMA Internal Medicine, that the first thing is, yes, there is a possibility that yes, this Ozempic may affect a little bit on the brain. That's just the discussion part. Okay, I'll come to the conclusion in the end. That's what led to the discussion that it can cross the blood-brain barrier, so it has a potential to get into the brain. That's why the scientists said, because it does have that potential to get into the brain regarding that blood-brain barrier, so let's study it further, because if somebody can take Ozempic and get the neurological or psychiatric effects of the Ozempic, then yes, there is a possibility that it may cause some side effect in that connection. But the pretty dramatic effects that were found about Ozempic, they are really good. For example, it can decrease, or any drug that affects the same receptors, same neurological or brain receptors as Ozempic or any drug in that same family they have this kind of benefit that it can decrease the compulsive gambling or shopping, reduced alcohol intake, and it can even help reduce or quit the smoking. Those are the good things, but you wonder whether they could be having some effect on psychological reward system, or maybe disrupting that in some place. So, or it could be something that could lead to the despair. So there's a lot to study about it. That's why it was followed through with a lot of discussion, as you can see in this publication. I will post a link to that publication so that you can go over it. And so the thing is, it's important that according to this latest study, it was found out that there's an overall risk of suicide in 25% higher of the GLP-1 receptor agonist user. There is that, but the margin of error is very large here, ranging from 17% reduction in risk to an 88% increase. When death from suicide and non-fatal self-harm were combined in this study, they found out that actually it's protective. And therefore Ozempic is not being stopped from the market for this thought that okay, it's not harming your brain, it's not affecting your brain negatively, it's not a significant correlation. So let me be very clear that Ozempic is still not a causative agent towards suicide. That's the conclusion. That the negative results are tricky. However, you can conclude that there is no relationship, as you can see from that data, that there is no evidence of a relationship between Ozempic and suicide, which is the case here. But it's harder to conclude that because yes, it does cross blood-brain barrier. So that's why you do need to look at the range of the effect estimate and data from the high quality, large production based study are consistent with the Ozempic and sister drugs, preventing the suicide or increasing the rate significantly. So you need to be very considerate about that okay, it's something that can affect your psychology. So it would be a good idea to get it prescribed by your doctor. Don't self-medicate. I think that's the biggest take-home message from this, that yeah, because it has something to do, so you need to be careful about it. You need to make sure you are in connection with your doctor. Let the doctor do this job, and don't do it to yourself, because what if anything happens to you? Life is precious and you don't want to risk it just for that small thing. And there are millions of ways to lose weight. You can check out a lot of my videos on my channel about losing the weight. It's not the end of the world that okay, you cannot take Ozempic, then you cannot lose weight. No, it doesn't work that way. I hope I was clear, but there's a lot in this study, there's a lot in this whole publication. So if there's anything confusing, please ask me in the comment section, or share your experience with Ozempic. Share your experience about Ozempic in the comment section so that we all can learn from each other. Thank you so much. Have a great day. Bye-bye.